So I chose to do my project on the impact of exercise on depression, and I chose this because there's so many people suffering today from depression, and really the rates only go up year by year. And I also feel as though doctors are more reliant on prescribing medications instead of exercise, and it's just not really widely known what exercise can do for depression. So I hypothesized that any kind of exercise would help a little bit at least with the effects of depression. And I included the graph below to show the prevalence of depression. It's split up between male and female, and then it's split up between age range, and then by race. So upon research, I did find that pretty much every source concludes the same thing, that exercise does help with depression. And it was found that aerobic exercise is the most helpful for those between the ages of 14 and 60. Those were the age ranges of the studies that I found. And it was also found that if aerobic exercise is not possible for the patient, some exercises such as stretching can also be really beneficial for those people. To me, my reflection on this was I was not really super surprised, but I was a little surprised at just how effective it can be to have exercise in the prescription for someone who is suffering with depression. And especially when combined with therapy, it is maximized effectiveness. And also, if someone is on a medication that they already know works for them, it can also help them to have exercise put in their prescription too, because in combination with their medication, it can be really helpful for them. I've also included the picture below titled Treating Depression, just to kind of give the visual learners an easier way to check out what I'm talking about. So the top part shows 3 common symptoms of depression, and the bottom part just shows how exercise can help those and kind of how it works in the body. The practical implications for this are that doctors could be a little less reliant on immediately prescribing medication and could kind of shift towards trying out therapy and exercise to see if that would work for the patient. And it could also help for those patients who kind of want to be more in control of their treatment and their treatment plan. And as far as future experiments go, I have one that I'd really like to see be done, which is on high school students, college students, and graduate students, considering the amounts of stress that they're under on a day-to-day basis and how demanding that is of you. And also due to the fact that that is the age range that has the most prevalence of depression shown in the graph to the left. And a second study that I would like to be done is kind of to check out how exercise would help with depression in the elderly population. And lastly, to compare how exercising alone versus exercising in a group would affect people and which one would be more helpful and why.